Thanks so much. This is panel 7 of our intense 2 days of testimony, and it's been very, very educational and uplifting. And I must say, we're following on the heels of the panel that preceded, which really gave this wonderful vision of the future of where we want the health system to go and how we can actually see that happening. None of the recommendations of the Future of Nursing report specifically called for culture change. But when we met as a panel in our first meeting to talk about our charge, to see what had happened and what should go forward in the future, we were struck by the fact that culture change was implicit in many of the recommendations. In fact, some of them, and I would say specifically recommendation 2, which called for expanded opportunities for nurses to lead and diffuse collaborative improvement efforts in interprofessional collaboration in preparing and enabling nurses to change, to lead change, to advance health, can't happen without culture change. So we decided early on that we needed to have some conversation about culture change, about what that means, and relevant to the report. And we also realized in doing that, we were calling attention to the fact that the success of all of the recommendations of the Future Nursing Report don't lie totally within nursing. They can't control everything that, while empowering nurses is an important premise in the report, the full achievement of the vision of the future in that report will require changes in others, and changes in the environment in which we work, and changes in the other health professions with whom nurses work. So we have put together a truly interprofessional panel to conclude our hearing by having a discussion about culture change. And our interprofessional panel includes, and I'm not going to give the full introduction, but just identify the professions and the expertise represented. Lawrence Brown, who's a professor of pharmacoeconomics and health policy at Chapman University School of Pharmacy. Rebecca Etz, who's associate professor and cultural anthropologist at VCU. Thomas Graff, MD, who's the chief medical officer for population health and longitudinal care services at Geisinger. Diana Mason, RN, PhD, who's a professor of nursing at Hunter College, and she's currently the president of the American Academy of Nursing. And Joseph Room, who is a collaborative consultant for NGOs. So what we want to talk about in this session, moving a little bit away from the more quantitative discussion we've had before, is culture changing? Has it changed in the last 5 years regarding the environment for healthcare education and healthcare delivery in which nurses are being called upon to play more of a collaborative and leadership role? What are the barriers to cultural change? And what recommendations would you have us make about accelerating culture change? So each of the speakers will have 6 minutes. The timekeeper is in front of us. I will keep you strictly to that so that we'll have time for discussion, because we need to end promptly at noon for the more public, for public testimony to be given. So we'll start out with, sorry, flip my page. Start out with Lawrence L.B. Brown.
All right. Thank you very